I am going to just start us because they asked me to. Hi, everyone. My name is Patrick Bodily. I am a field consultant and the state data coordinator for the Idaho Commission for Libraries. I have bribed my children to clean, and I have a dog that may show up, and I am calling my beard disgruntled wizard length of COVID right now. And so I've been asked to co-host with my friend Erin, who is going to introduce herself and just go straight to our next topic.
Hey everyone, I'm Erin. I am located in Columbus, Mississippi. I have one county, I serve one county. We have 4 libraries at our location. Our main library is pretty big, but the other 3 are very small and rural. And this morning, Mississippi Library directors met with the State Library Commission, and we started discussing what reopening might look like for us. And I thought I had a plan. I had worked out a plan, I had all these ideas, and I found myself just this morning like scribbling through stuff thinking, oh my gosh, that's not going to work. Why did I even think that was going to work? Now this is stupid. What am I going to do? So we kind of want to start today with talking about that, talking about, again, what reopening looks like, because we know that going forward within the next couple of days and weeks that states are going to start lifting their orders. My state, more than likely, tomorrow will be lifting its order effective on Monday. So we are really trying to figure out what we're doing in Mississippi. So we want to kind of open the floor to see what's going on in your state and what your ideas are that we can all kind of maybe tailor to our own specific needs at our own locations. So anyone want to share?
I guess we're all too polite.
I can jump in on
Go
that.
ahead.
Can you hear me?
Yes. Yes.
All righty. So our ETA for opening is May 4th, and our plan is to go immediately to curbside service only. And that would be a zero contact model. So we're lucky enough, we have just one big room, so we cannot section off areas. So we are going to be using our vestibule area as a middle ground. We'll keep the inner doors locked. People can call in and place requests for in-house items only. And then we'll put them in the vestibule for them to pick up. And we're asking that people kind of give us a rough estimate of when they'll arrive and to not enter the vestibule if another patron is already in there. We'll see how this goes. I have no idea, but that is the plan for now for our soft open.
I'll go ahead and chime in. This is Judy Bergeron from Smithville, and we don't have any dates associated with our phases yet, but like Kristen, we are going to start with just curbside and have it be contactless. We'll have everybody do their returns in the book drop so that we can continue to quarantine the materials for 3 days. And then we'll gradually open up for hours. With our first phase, we'll also open up by appointment only computer use on an emergency basis. So those people who have to come in and do unemployment applications and things like that, the Better Business Bureau loans, will allow them in. We'll also do printing services. They can email in. We don't have a cloud-based printing system yet. We're working on it. But we'll let them email in what they need printed and we'll have it ready for them and try and keep everything contactless. And then as the restrictions, and our city manager, I've been back and forth with these materials for him, and they're keeping us posted. They have no intention of reopening city facilities until they're sure that the risk has been reduced to the city employees. So they're behind us with this phased reopening.
Judith, hi, when are you opening, or when's your phase 1?
We don't have any dates set on it yet. I'm in Texas, and so there was talk about the businesses reopening for curbside in the state. as of tomorrow. And so I'm kind of thinking that we might be able to start curbside next week or the week after. May 1st might be a reasonable start date.
Judy, I think that's really important that you don't have dates, because this is, I mean, as we know, a very fluid situation. So you may have phase 1, 2, 3, 4, 5, and we may be moving from 1 to 2 to 3 and then sliding back to 2. So if we have dates, I just think it's really important that we realize this is a fluid situation so that we don't need those dates in place.
Can I add, for the, for books in the Dropbox, can I get a general idea of how everyone's handling that? How many days you're letting them sit? Are you wiping them off with alcohol or anything like that? Or
So that was something that came up this morning and with the Mississippi Library directors that were talking, and I know that there's a lot of different information that's out there. Two of the library directors, they specifically talked to somebody at the Mississippi State Department of Health they deal with disease and epidemiology and stuff, and they suggested 14 days. Like they said, the 14-day period for quarantine was probably going to be the best bet, and that's strictly quarantining the items. You're not wiping them with any kind of sanitizer, but when they come in, you're putting them in a box. You're putting that box hopefully in a room where there's going to, not be anything else, and letting it sit for 14 days and just making sure that you're marking your boxes so that you'll know when you can pull those boxes to check them in or to shelve them. And that's, again, without any kind of sanitizer on it. So if you use sanitizer, maybe it's a little bit different, but that was with no sanitizing wipes or anything like that.
okay, thank you.
Can you hear me? Can anybody hear me?
Yes.
Because it said I was muted by host.
I can hear you.
Okay, I'm Barbara in Gainesville. We're not going to wipe anything down, books being paper and that, but we will be quarantining them in our meeting room because of course our meeting rooms won't be working. I work in our smallest branch, which is rural. And basically it is one large room. We have two small conference rooms and a meeting room. So that's my understanding. And we don't have an opening date either, regardless of what Kemp has said.
This is Cindy in Michigan, and the 14 days, I have to admit, really surprises me because I had attended the virtual IMLS workshop with the CDC and the Smithsonian and the Library of Congress, and he was pretty specific that after 24 hours, paper-based circulating items were pretty much no risk of transmission. So we'd only been planning to quarantine our items for 24 hours and then wipe down the covers. DVDs, we're going to wipe down the cases and the DVDs in the inside of the case. Right now, we're not accepting donations, but we had been debating the items returned only in the external Dropbox, except for we do have some maximum limits on how many items of certain types patrons can check out, specifically like only 5 at a time for DVDs or Blu-rays, because that collection is relatively small and they're relatively high value items. So if we have the items only returned in our external Dropbox, then patrons who just return something, we would have to go and get those items to check them in or we would have to raise the limit. And we know we have some patrons that would abuse that particular privilege. We're gonna do a phased reopening as well. We don't have dates for that yet. We're in Michigan. Our governor is making an announcement tomorrow as to whether or not we're going to be extending stay at home or if we're going to move into a phased reopening and what that means for us. We were closed pretty quickly because as a place of public accommodation was the phrasing. So until we find out tomorrow, we don't know if we're even going to be allowed to reopen in May. But we're already looking at, no programming in May whatsoever. Physical programming anyway, doing video stuff, but with a strong trend towards food related things. food sustainability, home canning, freezing, and sort of like making ends meet kind of workshops, because we're seeing a lot of requests for that kind of thing. We're in a high poverty area, and food access is a big issue here.
I just got off a workshop, a webinar with all the major courier systems, most of them, 2 of them from Illinois, the one from Michigan. Our system, I'm Laura DeBon, and I'm the director of the Northeast Kansas Library System. Most of our publics are small. A lot of our publics, we have some large urban ones as well. That IMLS workshop with the CDC had no comprehension of the type of and variety of materials in 24 hours on a sheet of paper is possible and probable, but as far as a book, not so much. And so the IMLS is doing a study right now with, and we'll be filling out library materials and different things. And the answer is right now, nobody knows. And there is no particular definitive cleaner. There is no, for all types of materials. Bed bug zappers, if you've heard that, don't work. They're not hot enough. I just wanted to debunk that right now. We don't even know how the courier bags or the totes, or if you have a courier system in your state. We're all kind of up in the air, and we're going to meet again in 2 weeks after we get this thing filled out and we can get some actual research on the various materials. This group will be meeting on the 29th again. So I will let you all know, but don't plan on 24-hour quarantine. I've heard at least 3 days. So you'd have 72-hour piles. So I won't interrupt anymore. I just wanted to share that since I just got out of that meeting.
Laura, I'm sorry, did you say you were in a meeting with the IMLS folks?
It was IMLS. There were all the major courier organizations, a lot of them across the state. Mobius was there. Massachusetts was there. Michigan was there. Texas, the Amigos group was there. So it was dealing with both perspectives, the libraries and the transmission of those materials across the state and how those materials would hold their stuff.
So I'm super interested because the IMLS is also the one that presented the 24-hour with the epidemiologist from the CDC.
I heard that webinar,
so strange.
And
yeah.
I listened to that webinar. If you notice, it was very early on.
Yeah, sure.
And as we got into it with talking to IMLS more about the various types of materials, he didn't realize that books were even covered in Mylar or plastic. That CDC, I mean, he was giving the best information that he knew at the time. We know more now. And I would not plan on, gosh, I don't even know what to tell you, but I think 72 hours at least quarantine before you even check it in or handle it.
That is so interesting. Thank you.
That's just what I just came from. And I'm trying to think, I think it was Monica Evans, I believe, from IMLS is who's helping coordinate all this study, doing scientific testing. So.
Anybody else want to share any reopening plans, or what about supplies? How are y'all doing on finding supplies, and what are you looking for right now for your library? Like, how does that look in your area? Like, we could go ahead and make all these plans, but what if we run out of supplies? What are you going to do?
I recently just placed an order in with Amazon for wipes and disposable masks, more gloves, and we're still not even looking at receiving them until I want to say it's May 11th. So, you know, if they were to tell us that we could open on May 1st here in Michigan, which I really doubt we're going to be able to, having supplies is still going to be a difficulty on obtaining them. I mean, here in Michigan, toilet paper is still really scarce. If you find it in a store one day, you better snatch it up. And as far as the reopening, I'm from Croton Township. We're a very small library. We were able to do curbside for a small period of time before officially closing our doors. So we have that worked out, how we do that with no contact. But again, we would put everything into the drop box. At the end of the day, we brought it all in, wiped it down, left it on the table to quarantine for 3 days before we put it in a bag. When we do open up, because computer access in our area is very, is difficult there's a lot of people that do not have internet access. So we will allow only 2 people in by appointment with limited time onto the computers. We have taken we have 8 patron computers. We've taken all the keyboards off. So when they leave, we'll take out those keyboards, sanitize them. And I did put an order in for extra keyboards and mice. They'll also get a bag with a pen and some paper in it, and they get to keep it. Don't bring it back to me, because otherwise it's just going in the trash. Those are some of the things that we've come up with. I was on a webinar where they were talking that people have placed shower curtains down in front of their counters to help create a barrier because it's still clear. Apparently, they said some of the barcodes are still able to be scanned through that. I don't know about that, but that's something we're looking at, is hanging something as a barrier for our desk versus getting all the plexiglass, because that's quite expensive and it's not within our budget.
We also just bought a large amount of GLAAD press and seal. We've heard that it's to try and cover the keyboards. It sticks nicely, and then rip it off, Lysol it, put it back down, and it's kind of like another barrier that doesn't move. So if you're like me and you're desperate, we can't get sanitation supplies anywhere. Like it's a dead zone around here. So yeah, we just put in a huge order for GLAAD press and seal.
Hi, this is Sharon from Kansas. One of our libraries in Nichols, where Laura's from, talked about doing something that we saw in Pennsylvania, where they put a table in front of the circ desk and put the scanner on the table, so that then you have the 6 feet between the staff member and the patron basically is doing self-service. So they're scanning their card, they're scanning their materials on that desk that is a barrier between the regular desk and where they're standing. So that might be an option for people that don't want to do the Mylar or the plexiglass barrier or the screen.
This is Kate. I just wanted to ask Laura or even Jenny if you could post in chat the IMLS webinars that you attended, or enough information that folks who want to look into that and see if there are recordings can do so. And then while I've got your attention, just a reminder to everyone to please self-mute yourself if you're not actively talking. It cuts down on feedback and background noises. If we see somebody who has not been able to do that, the host will take care of that for you. Thanks, everyone.
Hi, I am in Texas. Our date to reopen is May 19th right now. I'm doing a lot of the same things that you guys have already said. Just something that I hadn't heard anyone mention that I thought I would is I purchased some fabric homemade masks for all my staff. And then also we bought a box of some of the surgical masks. We've gotten some of those, and then I'm instructing staff to wear the surgical masks under their cloth masks and then hand wash the surgical masks every few days, switching them out. My wife is a public health nurse and her job right now is COVID investigation. So we're taking this pretty seriously. Like every time she tells me something, I'm like, okay, everybody wear masks, everybody clean everything, so those are some of the things we have in place. Right now, my staff is working in the library, only 2 people in the building at a time, wearing masks, and we're not doing curbside or anything yet, but that'll be coming.
For those who are requiring their staff to wear masks, how are you handling people who are claustrophobic? Do you just tell them to kind of suck it up, or how do you handle that?
I don't know about the claustrophobic part, but my sister is an emergency room nurse, so they're wearing their masks like for 12-hour shifts and only pulling them down periodically. But there are kind of some things that they've already noticed, in that breathing your own exhale all the time, it does cause people to start getting headaches pretty quickly, and being discombobulated, not paying attention because you lose, because you're not getting enough oxygen. So I think it's going to be really hard for people to wear those masks, as somebody who doesn't like having that on my face either.
This is Cindy in Michigan again. We have several members of the staff, including myself, we're rating all of our quilting supplies and various other things, and making different styles of masks. Some are round and just cover the nose and the mouth. Some are more pouch styled. Some are a little bit more fitted and shaped, and those tend to work a little bit better for people with glasses because fogging is an issue. We've been looking at defogger options to make available. We've been advised that in general, while I can require my staff to wear masks functionally as part of dress code for this period of time, we cannot require the public to wear them when they're in the building unless it's backed up by a local ordinance or county or state law. And so all we can do is have signs out requesting people wear masks and making them available. So what we're also working for is not just a large supply of masks for staff to be able to change them out every 2 hours or so, and then wash them at home and bring them back, but also to have a stash available for the public so that they have absolutely zero reason to not wear one unless they've been advised by a medical professional to not wear them. Some of them, people with breathing difficulties and children under the age of 2 are not recommended to wear masks because these are they're not protective so much as they are preventative. I think that's pretty clear that the N95s are the only ones that are truly protective, and only if you wear them properly and have the sort of gap training on how to make sure that they're sealed against your face properly. The more people we have wearing masks, the better. So we've even raided our craft stash and found a big old spool of donated elastic that had been donated to the library that hadn't been used. If we're making these available to the public, I don't see it as any more of an any less of an appropriate purpose than making hand sanitizer and like Kleenexes and toilet paper available to the public. They're all sort of a sanitation health thing. So yeah, we're making masks for the staff in different styles so they can find one that works best for them, and also trying to create a large stash to make some available to the public.
I'm Lori, and I'm in Indiana. And Chantel, I feel your pain. My husband is the food safety person at the Board of Health in our county, and he is also the preparedness director. So we've been living this in great detail since the beginning of March. Our library, we are in one of the highest per capita counties in the state of Indiana. We have a huge amount of positive tests and have had more deaths than any of the counties on a per capita basis. So we are looking at opening really slowly for our library. We, much as you guys are doing, we'll start out with curbside. We are also, trying to figure out how long things need to be in quarantine before we can put them back out. I mean, it isn't any different. Our questions aren't any different. We are also providing our staff with at least 2 masks that they can rotate and take home and wash. We have been trying to decide whether or not we could require patrons to cover their mouths and nose. We hadn't come up with a specific answer on that. We are still under stay-at-home order until May 1st, but we kind of expect the governor of Indiana to slow things down and do a real slow shift into getting things open. We are hoping. We don't know that we will follow the governor's guidelines because we are in a high per capita county. So we have all the same questions that you guys all have, and none of the answers that any of us really want. But it's nice to hear from other people in other states who are struggling with the same thing. So I appreciate everybody being here and sharing what they can share.
Yesterday at our executive team meeting, my city manager also was talking about requiring all employees to take their temperature before they come into the building every morning, and possibly asking patrons to also take their temperatures before we allow them into the building.
So we are discussing that as well. And our biggest problem is finding an available stash of appropriate thermometers. And the forehead read thermometers are as hard to find as, there's nothing in this area. We haven't been able to get Lysol or disinfecting wipes or bleach or any of those things really since March. And we are finding that those thermometers are also very difficult to get a hold of. We are absolutely going to require our staff to do temp taking in the mornings, but then we've also been reading that some of that's not necessarily the kind of information that you want, that really should take your temperature later on in the day, because your temperature rises as the day progresses. So we're not 100% sure how we're going to handle that, whether we're going to require first thing in the morning and then also in the afternoon to make sure that people are still well as the day progresses on.
So on the note of temperature, I think it's really important. I read a study recently, and being a bad librarian, I'm not citing it, but I can send it to you later, where they've done a study and the average temperature of a human being has actually risen over the last few years, and it's not 98.6 anymore. The average is more like 99, and I know I run 99.1, 99.2 all the time. I know people who run in the high 97s or the low 98s. So if you're going to do temperature, you've got to decide, what are you calling a fever? Because some people think of a 99.2 as a low grade fever, but for me, that's just every day. That's just me.
As far as the health department here is concerned, they don't consider it to be a fever unless it's 100.4. And that's kind of an across the board. I think everybody's going with that same temperature because that seems to be above where people will actually come in on a daily basis. So that would be what we would be looking at.
But what about the asymptomatic cases? George Stephanopoulos, his wife got very, very sick. He had no symptoms, but he tested positive. It's just so, it's like Russian roulette.
And quite bluntly, there's certain times of the month where I run hot anyway by nature, and I have a staff that leans older, and some of them are going through the change, and they may be completely healthy but be in the midst of running a little warm at the moment during a power surge, so to speak. And I have a question. I've seen something interesting in the chat. Is there anybody, on the next topic, if we get past this temperature question, and when we do, several people are talking about shower caps as an option for the keyboards, and I'd like to hear a little bit more about that.
I know that's something that I have seen, I think, in a couple of the Facebook groups, but I've not seen one way or the other if it works well or not. And I had wondered about, like, maybe, I know somebody mentioned the GLAAD press and seal, and then I thought, well, I have a huge roll of the clear saran wrap. I wonder, if something like that, would that work? But the shower caps, I have seen that in other groups as well. Anybody have any experience with the shower caps?
I don't, but Erin Shawn, the director at Hattiesburg, said one of his staff members had some, no, I'm sorry, it was another director here in Mississippi, said they had some left over that they used to, it's actually, I guess they're multi-use, but they used to cover their feet whenever they had to clean up vomit in the library to keep their shoes out of it. I guess there's a long story there, but you know, who hasn't cleaned up vomit? But she was trying them, one of their staff members was trying it over their keyboard for a couple of days to see how well it worked, and they said they had no problems with it, and it worked perfectly. So if you can get the shower caps, or I guess the multi-use that could also be feet covering, you can put them over the keyboards and just dispose of them. I wouldn't even wash them if you can avoid it. Something that I'm actually toying with the idea of, if I can get enough, see, that's the other thing, I don't know that I can get enough Lysol spray, but since we're not going to have all of our computers available for use, and I'm probably going to limit the amount of time a person can spend on the computer, because I'll be honest, right now, I don't want people lingering in the library for hours on end right now. I'm going to take the keyboards and mice from those computers that aren't getting used, and after someone uses a computer, I'm going to pull the keyboard and mouse, swap them, and then Lysol them, and then swap them and Lysol them. We've got enough wipes for a while. We bought a whole bunch when all this started. We may be able to get away with that. And then we'll move to coverings when we have to do that. But there's a couple of different ways around it depending on your situation. I think that's going to end up being the best for us.
I just want to chime in here. We had a chat on this in Idaho. What day is it? Tuesday this week. And Philip makes a really, really good point. They were talking about, you know, we want to maintain social distancing in the computer labs, so maybe we'll just put a garbage bag over every other so they can know their spacing. And the point is made that that's not really, we're still trying to be welcoming. We're still trying, I mean, we're public libraries, right? And so where Philip was talking about pulling the mouse and the keyboards, same result. Still can't sit there. They still can't use that. You're still maintaining social distancing. And then with the added, all right, and then we can swap them out. So you're not, I mean, it just looks better. I think that was a really good point that Philip made.
This is Jennifer in Texas. What we've decided to do is have people print from outside right now. Our Wi-Fi can print to the copier inside. And we've been one of the people that have stayed open the whole time and done curbside in my small rural county. We've done some other things as far as staff working in other departments in order to keep people's jobs. That's what my county decided. But what we're going to do is have them print, and we'll do it like our curbside. We have a no contact curbside where we put them, they call us when they get out front. We've already put their bags, their books in a bag. We put them in a bin outside the doors so nobody sees each other. People know now that when someone's up there, they're to wait their turn. And we're going to do the same thing with copies and faxes for people. But we're not looking to really open until the public until late summer. We're just going to do everything really slow. We don't have, like probably most of you guys, our best medical facilities are 45 minutes away or longer. And it's not worth it to us. We only have 5 cases, but it's because my county has been really quick to jump on what was happening and kind of have us all be inside quickly. So is anybody else going to do just outside printing? I mean, that would give you options. And then once we do open, it's going to be definitely a certain number of people at a time and that kind of stuff. But I don't know how else. I'm not willing to let my staff have to deal with people who have questions on a computer. Let's think about it. You can't social distance when somebody says, I need you to show me how to get to this or whatever. You're there, whether you both have masks or not, that's an issue. So this is a way to kind of provide the service. And we've gotten permission not to even charge people. Anything under $2, they don't have to pay for. And most people just have 5 pages at the most. So this is something we can do, and it helps them out right now.
I really like that idea of not charging. I'll be honest right now, I'm not in the opinion of charging anyone for anything. I've actually got my board. We're going to take advantage of this opportunity, I think. I've got to get them to, they've said it once. I want to get them to say it twice. they've said it in email, we're going to, as a means of alleviating financial burden in this very difficult time, we're going to eliminate any overdue fees anyone may have on their account with our system as a first really big baby step to going fine free. But I'm not, if people had fines, they get ebooks, we got rid of all that, that's gone. I like the idea of not charging because I don't want my staff handling money right now.
Well, and for the stuff that's over the $2, because it depends on what it is, you can't print something for like 100 pages or, you know, because we pay for those copies as well. So I got my county judge, I'm a county library, so it's different, but I got him to say, you know, everything can be paid by credit card, and we can do that over the phone, you know, and that's what we've been doing for people who like lost books 5 years ago. We have to charge them for that before they can get an e-card. We just have to. That's how my county works. But everybody has a credit card, and you know, it's the discretion. We know what needs to be done and what shouldn't be done. And right now, if I can get them to say $2, great. If I can't, we're not going to not give somebody something they've printed. But this is a way to at least, like you said, Patrick, maybe at least look finally into not having fines at all. We haven't charged them since we closed on March 16th. And I would like us not to. The thing is I get to keep all that money we make from copies and fines. Most people don't. It goes back into the main general fund of their governing board, and I get to keep that. So that allows us to do things that we otherwise couldn't do. And it does make a difference some. So anyhow.
This is Anita in Indiana, in Du Bois, Indiana. I'm the branch manager of a small rural library. And to address the one issue the last lady who was talking brought up, I'm not a tech person, so I don't know how you do this, but our tech person is going to set up one computer in a room that when we do finally allow people to come in by appointment to work on the computer, they'll go into that room, use that computer, and that computer is going to be set up so that we can take control of it from the back desk, so that if they have questions, you know, we can talk them through it from being in control of that computer, but we won't have to be in the room with them. So I know it can be done. I just don't know what that process is.
So there was a question in the chat that I just want to make sure we get to. Kathy was asking, and I don't do it, so I can't answer, but those of you that are involved with curbside printing, could you explain that a little bit more, what all it involves?
This is Judy from Smithville. We haven't done it yet since we've closed, but we used to do it before, as people would email their items that they needed printed, and they would just come in and we would have it printed for them, or we'd print after they came in, made sure that they paid. We are working on getting a cloud-based printing system that they would pay up front, and so we wouldn't have to exchange any money. They would just pay, it would print out, and then they would come and pick it up. And for us, it would be a contactless printing. We would not put it out on a table until that person, if they called or knocked on our door and said, I'm here, then we would put their printouts there for them. So that's what I presume it will look like when we do start that.
Yeah, I'm like Judy. They can just print from in their car, and it goes right to our copier through our Wi-Fi. That's how we have our copier sent up with our Wi-Fi. So we have a lot of people who are already doing that inside the library. This way we can just keep it outside. We know that it works in their cars. We've tested all that. My staff tested it earlier this week before I submitted my reopening plan to my county judge yesterday. And it makes the most sense. And then once it's printed and we check to make sure it's okay, then we tell them, we call them back because we have them call. And yeah, I worried about privacy too. I see it coming up, and we talked about that, my staff and I. And what we've decided is we'll just put it, it's no different than when they print to the copier behind the front desk for us. We don't have a copier in the open for people to print to. We keep everything because we worry about the privacy that way. And so what we're going to do is put it in a plastic generic library bag, write their name on it, and put it in the bin, and they come up and get it. And that way nobody, hopefully, besides staff, will see what's happening. So.
Okay, thank you.
So I think right now would be a good time to kind of transition, because we've seen some other questions in the chat specific to summer reading plans and kind of what that might look like for your library. Are you going to be doing things virtually? Will you be offering take-home projects, take-home crafts? Are any of you going to be utilizing services like Beanstack? So would anybody like to kind of start telling us what their plans are currently for summer programming? I see Judith put her hands over her face. I know it's like, oh, it's so stressful. Do we have to think about this? But
so
the good thing about this, y'all, is we're all doing this together. Like, I keep telling myself that over and over. This is not just something that I'm going through. We are all going through this. The whole wide world is going through this. So that does make it a little bit more bearable. So I'm happy to know that I'm going through this with all of you. So, Philip, I think you were going to say something.
Yeah, so we've been doing, like a lot of people, we've been doing video story time on Facebook and so that's been sort of a trial run of how to do sort of online video programming. So I have, with my children's librarian and my teen librarian, I have told them, we've been having conversations. We're going to have a Zoom meeting soon. I have one who lives in an area that has terrible internet service, so we haven't really even been able to do that. Her phone service isn't even very good. But I've told them, cancel performers. We're not doing that this year. I've told them to develop for me both a hybrid plan for in-person and digital summer reading program, and a purely digital summer reading program, because we don't know which is going to be available to us come June and July. I want to have both available. What we do know is we will not have what we traditionally have as summer reading program. There's just no way that can happen. So I'm actually leaning towards we're going to do a purely digital summer reading program. That's going to involve some making videos. If you want to do some craft style stuff, doing some videos of more story times, more readings. I think we're going to rip out the competition reading style version of things. We just had a meeting with our state library where they talked about some ways of counting those stats for your programming. But I really think we're going to push our Facebook page as our center for summer reading programming.
We are going to start out completely virtual. We're going to use Read Squared. We were very fortunate to get a large grant this year for summer reading before all of this happened. And so Read Squared comes in at about $500 a year. So we're going to start with that. It is good for youth all the way through adults. So we'll be using it for all of our programming. Our children's librarian is in the process of contacting all of our performers and asking them if they would be willing to come to our library and actually do their performance as Facebook Live, and then also let us video record for uploading onto our website for a limited period of time, maybe 2 months for each performance. We don't know. We want to be able to pay those performers if we can, because we know that they too are struggling because all of their their livelihood is based on all of those performances that they do. And so we're hoping that we can work something out with them that will benefit all of us. But as of right now, we're doing only virtual. If we can get back into our library and we feel like we can have a small amount of people in at a time, we may do something in print as well. But we're also talking about mailing all of our prizes. Our prizes will range from books for the kids. We're going to mail those. And then we're also going to purchase for the adult program only gift cards and other like gift certificates for local industry, local businesses, restaurants, and other things, so that we can also put that money back into our community that way, and not ask for any donations of anything, but just to simply purchase gift cards and gift certificates to local businesses, particularly for our adult programming. But we may also be doing some like Dairy Queen cone certificates and that kind of thing to purchase as well. We feel like it's really important to put that money back into our community. And we feel like that's something that the library can do.
Yeah, we've already been contacted by a couple of our performers about at a pretty reduced cost, they would do a performance where they are and then give us a link that we could share for a limited period of time, which so far so good. We're still in negotiation, but it seemed to be a way to do virtual programming with performers. Probably everything will be virtual at least through probably mid-July. Then we're looking at bigger spaces, like holding summer reading in the park where people can spread out, or even one of the churches, because all our branches are small. The meeting rooms, air circulation varies. Let's just go with that. And so with 14 little branches, I think it'll be individualized, but we'll start out with one general virtual program. And our children's librarian is working with the state library in Washington to see if we can, what sort of support they can give for virtual programming, which in the past we have done very little of that. So that's kind of where we are. We were told to just do basic summer reading programming planning, as far as if we're going to make a short video on each of the themes or something, but we're really waiting for more direction. Normally summer reading for us is June through the end of July. We're looking at July through August now. So, and as far as adult summer reading, I don't think that's actually going to change much, because it's always been kind of a bingo thing, not so much programming, and people will be able to submit those digitally or however, and then we're working out whether they'll pick up their prizes at a drop-off or just mail them out, and we may go with mail out. So.
This is Cindy in Michigan again. We're also just investigating the bingo style, and we're really liking it, as well as some of sort of the grab and go send home programs with a virtual hybrid kind of component. I love the idea of mailing the prizes. I love the idea of moving some of the events later in the year to parks to allow people to spread out. We're also working to work with some of our partners that we have, because a lot of our partners are moving to virtual. Oh, sorry. This is Cindy in Michigan, and I don't know if it cut me off there. We're doing the bingo style. We're looking at doing this hybrid sort of model, including a lot of send home things. The big themes we're planning, or that we're expecting to see, are related to food access. We expect we're going to see a big increase in people interested in learning how to put up do sort of like water bath canning kind of things as summer produce comes in. I love the idea of moving events to the parks to spread out. We're also working with our partners, like the Michigan Historical Society has moved their History Hounds virtual webcast history events to, they've increased them to weekly right now, but they limit it to only library members. So we're looking at doing an online registration and then sending the access information only to those people who register, who want to attend these more adult sort of history focused events. And those are going on right now. And that is a free service to any Michigan library that is a member of the Michigan Historical Society of Michigan. Also, we've been contacted by our Michigan State University's Extension Office about their moving some of their spin classes, which are not cycling classes, they're special interest classes, to a virtual model, and with the library being a partner on that. And I'm planning to resurrect some of my programs that I'd done before on homemade Greek yogurt, homemade baking bread, homemade bath and body products, homemade laundry detergent, homemade toothpaste and mouthwash, those kind of things that I already had handouts for, that I would basically just have to film a video for and attach those handouts for people to be able to do them. And maybe we can send some supplies home to people who have registered.
So there's some talk in the chat box. Julie was talking about the brag tags, and Lori asked if you could elaborate on that, Julie.
I bought a zip file that has
Julie, I'm afraid you're not coming through. We need to get your answer via chat.
And
Kansas, I can press the brag tags.
Is since we know that a lot of our community partners are not going to be okay. Okay.
Patty, did you say that you could also weigh in on the brag tags?
And SoulLife.com, and I put a link in the chat, makes them very, very reasonable. And it's a dual-sided plastic tag, and they run anywhere from 22 to 12 cents a piece, depending on how many you order. When you get higher numbers, they'll do your imprinting for nothing. Yesterday, I had a long conversation with the owner of the company, and she needs to keep her people working. So as many orders as she can shoot earlier, the likelihood you're going to get a bigger discount. The tag is a standard, the size of a standard dog tag, but it is plastic. It coated on both sides. They have 24-inch, the little ball chains. They have 30-inch chains. They have 4-inch key tags, and then they have a nylon ring tag. Basically, and I was working for my entire regional library, so I was looking at big numbers yesterday, but you're looking, you can get them basically as cheap as 36 cents for a chain and a tag for each kid, and the higher you go, the cheaper they go. Once you get to the 1,000 level, you can do it for 25 cents a kid. And so this would be the opportunity if you have libraries in your area. I'm encouraging mine to group together to basically save the money and give up the imprint, because you can cut the price so much. And then with the beads, Oriental Trading seems to be the best place to go to do the beads, and they sell them a 1 pound bag for 2,000 beads for $9.99. And always look for coupon codes from Oriental Trading, or have an extension put on your browser, and that will save you a lot of money from OT as well. I can put that information all in the chat for you because I did all the work yesterday for hopefully for applying for a grant. The company name is schoollife.com, SCHOOL, capital LIFE. So it's School Life all together, but there are 2 L's in it.
For those of you who might be looking at that, they have a number of items that already have the theme. You're not going to be able to see that. They have the theme for this year's summer reading program. If you see SLP, they've got quite a few different tags that already have that theme.
For our, we generally don't have a whole lot of summer reading participants who are above the age of 12. I'd say like every year 60 to 70% of our students kind of fall in that 4 to 10-year-old range, but this year I am looking at including some geocaching sites, trying to set up 4 or 5 of those and just make it, you know, it's not something that we can include a lot of incentives, but we can make it really fun. There's a lot of YouTube videos about making a really good cache, making really creative things that you can hide, and kids have a lot of fun, you know, finding the cache and taking it down. So that's something I'm interested in doing, but I've never done it before, and we'll see if that's going to be a thing. Has anybody done geocaching?
Does anybody have anything else they'd like to share? Any kind of good news? Anything that's been awesome that's at least happened during this? Anything happy?
Going back to the geocaching, sorry, I was eating a baby carrot right when you asked that question. A few years ago, I did a geocaching program at the library that I used to work at, and I also did a presentation on using geocaching at the Texas Library conference. It's been maybe in 2014, I don't remember, but if you look online, there may be still a copy of that presentation floating around. But it was pretty popular. We made geocaches all over our city, and they had different like book themed things to them, and we also worked with local businesses to have them, if they allowed us to put a geocache on their property, and also in different city parks and stuff to kind of get people to go to some of those businesses and some of the parks that are maybe not as popular to increase awareness.
From Kansas. I have a happy story. Today was our weekly staff meeting, and I asked my boss to not have an agenda so we could play because it's library week. And I created a dumb little game for us to play, and I wrote a Mad Lib that they had no idea what it was going to be. And it's so much fun for grown-ups to just be silly and play and forget what's happening in the world for now.
It was something sweet that the library was able to help out with today, is that I got a call from, so there's a lot of food distributions happening in our community because we do have a fairly high level of poverty in our area. They're distributing over 200 food boxes in a normal 3 times a month food distribution, but they're also doing about 200 boxes a week to seniors, and they're being coordinated and delivered through the churches. And Michigan at least has a main number, 211, where people can call with needs. And there was a senior who was in lockdown in a senior care facility, an extended care facility. And her two main needs, just right off the top of her head, were food and yarn, because she's almost out for crochet. And the library had done an arm knitting workshop many, many years ago, and we put out the call that we need yarn. And we ended up getting about 4 boxes and 7 trash bags full of donated yarn in a very short period of time. And so we have rolling carts, rolling shelving with bins of yarn upstairs that our Yarn Craft Club has been slowly working through over the years. And an absolute ton of donated knitting needles. And we've been thinking about how we could try and make some of those things available when we're locked down and can't do curbside. And so I was able to immediately run upstairs to the library, pull out a whole bunch of the little balls, the half skein, whatever, throw them into a bag and get them over to the food hub to distribute so that she could take them to this lovely woman. And it made me feel good that that was something simple that the library could provide. If she's asked what her top needs are and it's food and yarn, then hot darn woman, I will give you out of my own stash if I need to, but I will get you some yarn. And I just know that it made her happy right now. So that was a lovely part of my day.
I think that's the best story we could end on. We're up at the hour. Thank you all for coming. We're in this together, 6 feet apart at a time. Any other closing words from anyone? But thank you all for being here.